like for me, like I probably just needed more of it, you know, than I got. You know what I mean?
Yeah.
At the time.
How long ago was that? Oh, you got
It
bee
was,
venom?
it was a long, long time ago.
Oh man. Well,
Actually, it softened the scar, but I still think it was probably a lot deeper.
the the idea is if you think that it's the bee venom, then your goal is to put the bee venom in. It's not
Yeah.
to stimulate. And if you use a thin needle, then you're not stimulating as much as a large needle.
Yeah.
So if you think of stimulating, then you will see the results much better, and they'll come more quicker. This is a 27 gauge needle. I'm going into his scar today. We worked on the scar last week, and he was bending 25 gauges, and now it's
Remember, you remember I laid like you worked on it,
uh-huh.
and I wasn't I laid like I wasn't adjusting my neck. Remember I
Yeah,
kept getting up, adjusting
yeah,
it,
yeah,
and you get stuck in it, and all of a sudden it's like, boom, kind of released it.
yeah. Now some people are going to think that this is uncomfortable. Do you feel this at all?
No, actually, I don't feel it.
So you just feel me pushing around?
Yeah.
Okay, because I'm literally.
Every now and then I feel a little bit of a stick, but
Mm-hmm.
not too much.
Mm. And I worked on him a whole lot last time, and I was expecting some bruising, but no bruising whatsoever. Oh, oh, you may have a knot there. I feel something. So once it starts to bleed, that means we have broken down a lot of the fibrous bands, whatever you want to call them, and blood is flowing in. And if blood flows in, then you have healing. And that's the thing about a tight muscle. A tight muscle will block nature from going in, mending. And if nature can't get in, nothing can happen. Ooh, that's a good. I can't. I gotta get a larger needle for that one.
Yeah, I've been, like I said, like since our last treatment, I've been doing my stretching. It's like jumped up like quite a bit significantly, like just my ability to flexibility.
Okay.
It takes me a while, like to turn to the right. It'll
Mm.
take me a while to get, like you said, like you didn't see me turning it, but I can get it to where it'll warm up and do it. And before I wouldn't do it. It didn't matter how much I was working on it. Yeah, I've been, I spent like an hour and a half stretching last night.
Good.
It's almost like the looser you get, the more you want to stretch, you know.
You okay?
Mm-hmm.
Ooh, is that a bruise or what? Let me see.
Does it have the Atlantic angle on it? Is that why I don't? Because I'll feel those little needles I try to put in.
Yeah, yeah. This is so dense. I don't think there's any nerve fibers.
Yeah.
They should grow back. It just may be a empty, no sensation area for the rest of your life.
Yeah.
Oh, there's a little blood there. That's interesting. Huh. Mm. There's something there. It just won't go through. Mm. You alright? You know, in hindsight, I wish I would have done this long ago. It could have leapfrogged you ahead. Um,
the next guy that comes through.
Yeah, exactly, exactly. Because I have a bunch of folks who have these scars.
Actually, I think about that Sam's husband. Like I
Sam.
feel like if I can, the little girl that, not little girl, but young lady, he worked on her shoulders, and her husband is like basically named from that.
Ooh, you okay?
Yeah. Anyway, so he's got this.
Maimed from what now?
From so what this the surgeon operating on the Baylor like killed 2 people, named like 4 people.
Oh,
her
my
husband was one of them.
Is he in jail, I hope? Probably.
Yeah, he is in jail. He has like a $500,000 bond. So I think there's still a trial going on.
Mm-hmm.
But, yeah, I mean, he was.
Ooh, you're bleeding. That's good. This is good.
He was on cocaine, and
Oh,
I think
jeez.
he's associated with that because, you know, even when you take the cocaine away, he still he's a psychopath. He's killing people, doing surgery on his head, on drugs.
Mm-hmm. So I'm sorry. So what happened with his?
With him, he has they call it arachnoiditis, but he's got trapped nerve and.
Okay, now very important. I've read about that, and that's not completely true.
Yeah.
Is he local?
You talking about the doctor or Barry?
The guy.
The friend?
Yeah.
Yeah. He's you've seen Sam before. You'd recognize her if you saw her. It's her husband. I've been trying to get him to come in, but he's just like he's kind of feels hopeless, you know.
Yeah, it's
like tons of stuff every day.
The okay now so anytime go back to scratch, and if you have pain has a source. So doctors will give a pain a name. That doesn't make it true. Okay, so if you have a diagnosis, you treat it, and the diagnosis should go away. It should be like in the past. Pain diagnoses, there's a billion of them, and that means that they are grouping of symptoms, signs and symptoms. They're not being treated. They're just being managed or pacified. This remedy will go in and allow Mother Nature to figure it out, to mend it out. If you never do that, you'll never know. So he's just sitting there. I'm going to go this way. He's just sitting there in misery, and the system just letting him sit there. And he should be being offered a whole bunch of stuff. Oh, you okay?
Well, as soon as I get like really freed up, I think that'll be good evidence, you know, for him.
Oh, okay, now guess what? It's like Jesus. He would ask people to follow him, and they wouldn't, which is okay. I have neighbors, I have patients, spouses of patients who won't come in. They see their wives or husbands getting better, but they won't come in. So, and I've had a few who've had surgery. It's like incredible. And the wife or the spouse will come in and say, well, I couldn't get him to come in. He had surgery and now he's miserable.
Probably done some of the more of the traditional acupuncture. That's what Barry's done, and you know it's just not.
Oh, it ain't. No. If he is scarred up like this, you can't get the needles through.
Right.
And that's the reason why acupuncture is a profound remedy. But if you use it on the wrong problem, you ain't gonna make no progress. If I have a thin screwdriver and a big screw, the screwdriver is just gonna I'm gonna run the screwdriver and the screw. But if you have one that fits perfectly, it comes out perfectly. Okay, I'm going to, let me go up a little higher here. Which side bothers you the most?
It's more like the right side won't stretch.
Okay, this side won't stretch.
Yeah, like if I
Okay.
try to turn my head this way, like it has a lot, it won't let out.
Okay.
Now it's been letting out more than it ever has. It's just still not there.
Okay. Let me.
So it feels like I need to poke it a lot more to get it to wake up more. Woo.
I'm going after his scalenes and all the other muscles. Oh, I was counting the muscles. There's like 1 inch muscles in between. Oop, that's a good spot. In between each vertebrae, and I counted about 12 or 14 muscles in between each spinal vertebrae. There's these little stabilizers and rotators and multifidi that once they get infected, they will not let your spine rotate. Now, in the next few visits, I'm going to go down to them just to see what they feel like. And if you go and look on a anatomy book, you'll pull them up, and it's just hundreds of them, hundreds of them. I'm gonna turn this thing off.